Now come back to me.
Are we required to take notes?
You're not required to take notes. And once again, like I don't care what you do. Just as long as you're with me. Like now, I will tell you, I'm cutting you all some slack, but soon I'm gonna start taking away phones. Yeah, man, I don't care if I'm not talking. You're on your phone, no worries. Okay, but like as soon as I start to get into it, stop doing what you're doing and come back to me. Okay, it's okay. Like I'm with you. I'm on my phone. I like my phone. Okay, but just stick with me. You know, I showed you this, right? Did I show you this? You know, you could do drawings if you want. You could do no notes. Okay, some people just get it. I'm going to be giving these to you. There are some times where you might want to say like, okay, I think this is important. And if you change your mind, okay, after our first test, you're like, oh crap, I should probably write some stuff down. Then fine, go for it that way. Okay, it's totally up to you.
We can use notes on the test.
You cannot use notes on test. Sorry. Yeah, right. I know. Sorry. All right. Okay. So let's talk. We've been talking about the fact that we're organized, right? That we have that, you know, we're made of cells. Those cells make up tissues. Those tissues make up organs. Those organs make up systems. Those make up the organism, right? We also know that those tissues interact with each other and those chemicals interact, and we can have maybe a high metabolism or a low metabolism. And I guarantee that every single one of you in this room will know someone in your life with one of these conditions, and that is hyperthyroidism or hypothyroidism. And every time I've mentioned that today, I see some head shaking saying that not only I know someone right now, and then a couple of people have come up to me and said, you know, I've got that, right? You know, and so hyperthyroidism, there's too much production of the gland, the thyroid, that increases your metabolism, okay? What sometimes lower your metabolism, okay, that interaction between the chemicals in your organisms, and a lot of times people associate metabolism with gaining weight, right? So high metabolism, can't gain weight, low metabolism, okay, can't lose weight, okay, right? So sometimes you hear people say like, well, you know, I weigh this much because I have hormonal issues, right? That's where that's coming from. There's that hypothyroidism. That's that lower, okay, or under. Hypo meaning under, hyper meaning in excess. We're responsive organisms, right? We maintain our internal environment. Think about when we get cold, what happens to our skin. Yeah, we get shivers, we get the goosebumps, and that increases the amount of surface area on your skin, and therefore more chance to absorb heat. Okay, we grow. You know, I looked at some of these kids like that I haven't seen for 6 months, especially some of the freshmen who are now sophomores who grew like 6 inches. I'm like, man, I don't even recognize you, right? We're doing it. By the way, you all stopped growing around 25-ish, you know, somewhere around that time. Some of you, you know, guys definitely grow later than ladies. Development, we've developed through time and, of course, reproduction. We'll talk more about those later, especially after you sign that paper. All right, let me talk about this picture. Now, in the past, I required everyone to draw these two pictures. Again, you don't have to, but stick with me here on this today. All right, so I'm going to blow these up. We've all been to the doctor, hopefully, and at some point the doctor says to lay on that table with that little crappy piece of paper on it, right? You know, that somehow it's going to protect you from disease. Yeah, you know what I'm talking about, right? You lay there, it's all crinkly and stuff, and then the doctor takes his hands and he presses in these quadrants, okay? He's looking for any abnormalities or any pain in those quadrants, okay? So we could say that we divide these up into basically 4 big areas, though. Right upper, left upper, right lower, left lower. Now, when you look at this, sometimes people are like, Ms. Berth, you dumb, okay? Because this is the left side, and this is the right side. Why do you say right here, and why do you say left here, okay? Right? Anytime you look at an anatomical drawing, okay, you're looking at it as if you're that person. Y'all with me on this? So if this was my body, okay, right? This is my right hand, okay? This is my left hand. Y'all with me on this? I'm going to remind you of this a lot, and it seems like kind of confusing, but just get used to it, Okay, y'all with me on that? Okay, good. So your liver's on your right-hand side, your left-hand side is where your stomach is. Okay, and then over here is where your appendix is, right here. Okay, that's on your right-hand side. Here's your sigmoid colon over here on your left-hand side. But not only can we divide this up into 4 quadrants, we're going to go ahead and divide them up into 9 very specific areas. Okay, now, real quickly, I'm not going to call everybody. I want everybody to just do this at your desk. Okay, on the count of 3. Show me using your hands, with one hand being the top and one hand being the bottom, like this. Okay, I don't care which way you do it. Okay, show me on your body where you think this picture is, from top to bottom. Okay, okay, good, good. Okay, very interesting. Okay, some people looking around like I'm not too sure. Okay, that's okay. Okay, good. Now, most people do it from here to here, like belt to like, chest area, right? Maybe some went a little bit above, some went a little bit below there. Okay, technically it's a little bit higher and a little bit lower. So I'm going to show you on Chad. Okay, so if Chad was the hands, I'm going from about right here, okay, to about right here. Okay, so the xiphoid process, which is a part of the sternum, okay, and then can you see Chad? Okay, oh, let me tilt this down, Matthew, a little bit so you can see Chad a little bit more. And Trinity, you're on with me too. Good. Okay. So, and then down to here, this bone is a hip bone. Okay. This bone that's a part of the hip bone is into 3 pieces. The iliac, we've already talked about, or the ilium, this is the iliac crest. Okay. The ischium, which is down here at the bottom, and this front part is called the pubis. Okay. So just, once you sign the paper, we'll talk more about the pubis bone in that area, which sounds you're with me, right? Okay, all right. So that's where we're at. Okay, and one reason we don't go that low, and it would be crazy. Okay, if you look at this, I should have taken a picture of the number of you that just kind of went like from here to here. Most people stopped at the belt. Most people didn't go lower than the belt. Okay, but look where we're at. Here's the umbilical region. What is the major landmark, do you think, in the umbilical region? Your belly button, right? Your umbilicus, right? So that's where your belly button is. So you got this whole region that's lower than that. And you see this little hump right here? What do you think that thing is? That's the bladder, right? That's the urinary bladder. Okay, so you're down into that pelvic region. Okay, right? Y'all with me on this, where we're at? Now, I got to tell you that some of these terms, you're like, man, some of these terms are like off the charts. Okay, like look at this word, hypochondriac. And you're like, wait, I've heard of a hypochondriac before. Okay, anybody know what a hypochondriac is? Okay, what is it? Okay, yeah, I saw your hand. Yeah.
It's like my mom always tells me that I am.
Are you?
You are.
Why are you, give me an example, Casey.
Isn't it where you like want to like be sick kind of? Or like
Where
you try to
you
like,
think there's something constantly
Yeah.
wrong.
Yeah, you think that there's something wrong with you. So I will tell you, you're a hypochondriac. It's like that. All right. I will tell you that I always like this teaching this class because it really ends up, I get a lot of hypochondriacs in this class because like I'll have kids stay after class and be like, Mr. Berth, can I talk to you? I'm like, sure. They'll be like, hey, remember that brain tumor you were talking about in class? I'm pretty sure I got it. Yeah, pretty sure I got that brain tumor. I'm like, I'm pretty sure you don't. Okay, but then like a couple weeks later, like, hey, Mr. Berth, you know that pain you're talking about that's, like in your right-hand side? You mean appendicitis? Yeah, I'm pretty sure I got that. Yeah. So yeah, always kind of thinking like I might have that disease. Let me ask you this. When we look at the right hypochondriac region and the left hypochondriac region, does that mean that that's where that comes from? Okay, no. Okay, so we're using kind of a different look on this term, right? Okay, and it's all about the prefixes and the suffixes. Now, Sarah took the MedTech class, And I will tell you that a few years ago, I had a student named Stephanie Buss. You guys wouldn't know her. She's been, I forget what even year she's graduated, but she's a nice young girl. She took my anatomy class. She said, Burnworth, you're going to want this. So I borrowed her book and I kept it. And now I keep it on my desk from now on. I mean, I just have it as like a reference. It gets shuffled amongst other papers, but it's always right there with me. Even though I know a lot of these things, every once in a while I get stumped. It's all the prefixes, major ones, prefixes and suffixes with medical stuff. And I love this. And if you really want one, I'll scan it for you. It's just alphabetical. So like, for example, if I want to look at like nod, N-O-D, what is that? That means knot or swelling. How about oblique, slanted, sideways? How about O-M? Like just the two letters, O-M, that's shoulder. That's a prefix for shoulder. Okay, stuff like that, man. I love this thing. Okay, and we're going to hit prefixes and suffixes a lot. And Sarah will tell you that that's exactly what you'll end up looking at. Okay, now every word has like a prefix and suffix, but look at this. We got hypochondriac, epigastric, okay, same with hypochondriac, okay, hypogastric, okay. Those are things that we can break down. All right, now, if we look at the right hypochondriac region, and nobody's gotten this right today, and so far, and maybe you're going to be the winner class. Let's see if you can get this right. I'm very excited about this. So Chad is the best way to explain this. The right hypochondriac region where your liver is, okay, I'm going to touch that region right now. This is the right hypochondriac region, okay? Now, hypo, like I said with the thyroid, hypo means like, you know, less than, lower than, under, okay, right? Hyper is like above, more than, you know, overproduction, that kind of stuff, right? Y'all with me on this? So hypo something, it's under something, okay? I'm touching the something right now. What does chondriac mean? That suffix, huh? Nice guess. The heart is actually right over here. Sarah. You're very close. Everybody says ribs, and you are kind of correct. These are the ribs, okay? This is not the ribs. Cartilage, okay? This right here is bone. This is bone. This is not bone. Did you know that that little part from basically here to like over here, it feels hard, okay? It is pretty hard, but it's not bone, okay? That's cartilage. You can actually, it's kind of crazy, but like if you're doing chest compressions on somebody, you know, like let's say Chad has a heart attack, okay? You're not going to break the sternum. The sternum is really tough unless you got osteoporosis, you know, you're really old, or you've injured this before, okay? Let's say you were in a car accident, you broke this, then you're going to maybe break the sternum. But if you hear a popping sound, okay, you know what that popping sound is? Yeah, it's just like your knuckles, right? You got like, you know, you're basically popping the knuckles between the sternum, you know, and this cartilage. Or, you know, somebody said, can you technically pop your ribs? I'm like, well, yeah, you could, but it's like, it's not like your fingers. You probably hurt yourself if you did that, right? So don't, you could probably break a rib, you know, don't try. Like tonight, you're like, I'm just gonna beat myself till I make my ribs pop, okay? Give myself chest compressions. I don't know why I always use that voice, by the way. It just comes out, kind of turns Southern when I'm talking about crazy stuff. All right, y'all with me on this? So hypochondriac, so chondro means cartilage. And we're going to talk about chondrocytes. What do you think chondrocytes are? Cartilage cells. Bringo. Site, cell, chondro, cartilage, right? So that Bringo. Remind me sometime. Maybe at the end of the day, I'll show you the video with Bringo in it. It's you guys like John C. Reilly. You guys know John C. Reilly? Yes. He's from Talladega Nights. He's Will Ferrell's partner in crime. Okay, all right. Okay, so I'm going to move this around, okay? Now, stick with me here. Right hypochondriac, so it's the right region underneath the cartilage, okay? Left hypochondriac, it's on this side of Chad, okay? Epigastric. Where would I find your epidermis? Yeah, your upper layer of skin, right? Okay, there's an endodermis, right? That's dermis. Okay, and epi, so we're above. So we're above the gastric, even though it kind of includes it a little bit. Upper gastric, that'd be above the gastric, so the stomach area, okay? This is the easiest. Umbilical, because once again, belly button. Where have you heard this word before? Lumbar. Yeah, lumbar support, okay? If I get a pillow, like a lumbar support pillow, where am I going to put it? On my butt? My lower back, right? Your body is divided up into 3 sets of vertebrae, okay? Right here is the cervical vertebra, you have 7. Right here is the thoracic vertebra, you have 12. Right here is the lumbar vertebra, you have 5, okay? So this lumbar region, okay, we're talking about right in here, okay? Right? So this is a lot lower than what you think. Your iliac is thanks to this bone. That's the ilium. So that's this region right here, the right iliac region. Hypogastric, below all of this gastric tubes. This is your small intestine right here. This is your large intestine here. And then the left iliac region is right. So when you're pressing down, and your doc will do this, not only are they pressing up here, they'll go all the way down into your hip area, okay? Because you got organs down there, okay? We'll talk more about those organs later after you sign this paper, okay? Right? It's amazing how much this comes up, you know? It's like, it's crazy. It's not like, okay, 2 weeks later.
How many more people have to have?
I don't know. Like, I think like not that many. I have to definitely give it 2 weeks. If we're like, everybody's like, yeah, we're good to go, then maybe after 2 weeks, then we'll look. I think there's a couple that I haven't heard one way or the other. I think you're the best class though, by far. It's phenomenal.
If the other classes don't, can we still?
Yeah, yeah. Oh, yeah, yeah. I just probably won't use your recording, you know? Because people are like, why are you talking about that? Right? Hey, by the way, for the first time today, this was amazing. And let me just throw this out here. I was kind of hoping, you know, this would happen in this class. I had a kid in my other anatomy class that was absent today, non-COVID related. Okay. I don't know what's going on. Didn't ask. But he joined my Zoom. It was so cool. So he's not virtual. He just was home today. I loved it. Okay. It was cool. Okay. So once again, you're welcome to join me. All right. Now we're getting into positions. Oh, this is my favorite part of this. Okay. All right. Stop it. Okay. Now we got Blue Man Group here. All right. So let me move this out of the way. Come on, Chad. Come on, Chad. All right. So, oh crap. Here we go. All right. Starting tomorrow, okay, we're gonna do some. This could be your first test in this class. You're gonna have it's out of 30. Okay, and here's how it's gonna go down. I'm gonna stand up here. I'm gonna say, number 1, what's this? Number 2, what's this? Number 3, what's this? Number 4, what's this? Number 5, what's this? Number 6, what's this? 7. Okay, 8, 9, 10, 11, 12, 13, 14, and then so on and so forth. Okay, these are all terms that we're going to use so many times throughout the year that this is so important that we're doing it, you know, right here in the beginning. Okay, all these different positions, because we're not just going to say like, oh, where's your stomach located? Well, it's right here. Okay, we're going to give very specific things like it is anterior or superior to the spleen. You know, things like that. Okay, y'all with me on that?
We're gonna know all that. by
We're
Friday?
gonna know all. Not you will. You will. I would be shocked if by Friday you didn't have a good understanding. Okay.
Wait, so we don't actually have a quiz tomorrow?
No. Sorry, did I say tomorrow's the quiz? Yeah. Tomorrow we're gonna start the stuff for a test next week. Okay? All right. Sorry. No test tomorrow. Okay, me dumb. All right. Okay. So I'm gonna kind of run through the pictures, and then what we'll do is you're gonna stand up and you're gonna touch yourselves. Okay, every single day. Yes, Gavin. Oh yeah. Sorry. You want this one? You want this one? Okay. All right. So and trust me, man, you're gonna get these. Like it's one of my favorite things now hasn't happened yet because kids haven't gone back to college, but I promise you, if it doesn't happen this year, I'll be shocked. Every year I get an email from a kid that graduated like the previous year, and they said, "Hey, I'm a freshman anatomy. Will you send me the video on your YouTube channel of you doing the flexion, extension, hyperextension, and all that stuff?" Every year, okay, that I've been doing this, I've had a request for that video, and I love it. Makes me feel happy. And then they share it with their class and whatnot. Okay, so we're going to talk about these anatomical positions. Okay, so the easy ones are right and left, right? Hopefully you know the difference between right and left. Though I have a friend, I kid you not, she's almost 40 years old, and when she's driving, I'll say like, "Okay, turn left," and I'll see her just kind of like very casually make this so she knows that the L is left. And then she'll turn. I'm like, "Oh my God, are you still making the L's? Like you don't know the difference between right and left?" She's like, "Shut up." I get confused and nervous. Okay, so right, left, okay. Superior and inferior. Superior on top, inferior on bottom. Like Jabin is superior, Bella inferior. No, I'm done. JK. All right. Okay. Okay. Now, I'm going to go with just the pictures here. Then we've got prox. Let me go. How much time we got? Let me just go to this picture because these pictures will show it a little bit better than that picture itself. Okay. So once again, superior top, inferior on the bottom, anterior and posterior. We're going to touch our stomachs like this. This is anterior. Okay. And then our back is posterior. I'm always reminded by my 5th grade teacher, Mrs. Carter, who refused to say things like "sit your butt down" because we would giggle when she used the word butt, you know. So she would say to our class, "Sit your posterior down in your seat." Okay, you sit your butt down, right? That was her way of not having to say the word butt. Okay, so and we had superior, we got inferior, anterior, and posterior. Okay. All right, proximal and distal. I like to think of proximal as like approximately. Like if I say I'm going to be there approximately like 3:15, what's that mean? Yeah, about or close to, right? So proximal would be here, okay? Distal would be here, okay? Right? So when we talk about phalanges, and these are your phalanges right here, your fingers, okay? Did you know you have 3 bones? If you didn't, make that little U there. There's one bone, there's another bone, there's another bone. So you got this one, and this one. This is the distal, okay, the middle, and the proximal, because it's closest to, okay, the middle line there. You'll learn all of those later. Proximal, close to, okay, distal, far away from the center line, okay. Give me like a couple more, and then we'll stop. Okay, medial, okay, is like the middle. The opposite of medial is lateral. Okay, I always think football, right? Lateral pass, off to the side, behind you. Okay, so medial, lateral, superior, inferior, anterior, posterior, okay, proximal, close to, distal, far away from, okay, medial, lateral. Y'all good so far? Let's end on this one. Deep and superficial. Okay. The other day I was recycling. Okay, some cans, and our recycling gets pretty full, so I crush my cans. Okay, right. I like to twist them, crush them. Makes me feel tough. Throw them in the recycling container. And when I twisted it, I mean, look at this, right? I just like ripped the can in half. It was kind of cool. But when I did that, what's that, huh? Can crush right here, baby. Boom, boom. I don't need one. Okay, I got my. So when I did that though, I literally like twisted open the can, like I was like kind of like, oh, like I was like, no, like literally like twisted it and like ripped it in half. So I like the top half here, the bottom half. I know. It's pretty cool. Okay, but when I did that, I looked down and there was blood everywhere because I'd cut my finger. Okay, here's the cut. Here it is. You see it? It bled for a second, right, or two. All right, you can't see it. Okay, what kind of cut was that? Superficial, just a tiny little cut, right? Okay, now if I were to take the homemade shiv that I made over the weekend, right, pull it out of my desk, yeah, I like to make it, you know, homemade shiv, and I would take that out of my desk, and then I would shove it into Josie's side, and then twist and watch her slowly bleed out. Okay, right? That would be what kind of cut? That's deep, right? So when you said like what's going on here, the superficial just means it's near the surface, right? Deep means I'm going all out, man. My prison shank's gonna really show her what's what, right? Yeah. I don't know what's wrong with me today, but thank you for what's that, man? Yes, I've thought about it. You're right. I've started to make one, and then I always back that truck up. All right. Hey, well, thanks for joining me, guys. I hope you were as entertained as I was this period, because I had fun. And just remember, you know, keep on keeping on. Maybe I should end every day with a motivational message. I'll sit down in my chair like this and say, thank you, youngsters. Thank you, future of America. Thank you, future of the world. Thank you for learning, for investing yourself in life. And I don't know what I'm talking about. Bye. Have a good day. Email me questions if you have any. Bye.
Oh, all right. See ya.
All right. See ya.
Why does this feel more like therapy?